Good morning, everyone. We'll go ahead and get started now. Thank you so much for joining us here today to celebrate the 47th anniversary of Medicare and Medicaid. My name is Matt Sinovic. I'm the Executive Director of Progress Iowa and the representative of an organization called Protect Your Care in Iowa. What we do is provide information and run educational events such as the event we're holding today about the Affordable Care Act and the benefits of programs like Medicare and Medicaid. So I'm very excited that everyone's here today, and if you haven't already, please help yourself to some snacks in the back. We have information, handouts, bumper stickers, and pill boxes for you as well. Brian's holding them up right now. But we are here today to celebrate the 47th anniversary of Medicare and Medicaid. For 47 years, these two programs have been incredibly popular. And they're popular because they're effective. They're popular because they work. They effectively provide health care for more than 500,000 Iowa seniors and Iowans with disabilities. Now, if you haven't guessed, at 47 years old, Medicare and Medicaid are just a little bit older than I am. But I may not be old enough to receive Medicare yet, but I want it to be there when I retire. I want it to be there when my parents retire. And Medicare, Social Security, health care, and just the ability to retire with dignity are values that we have to pass on from one generation to the next. Now, some call Medicare an entitlement, something that you're entitled to or something that's given away. But we all know in this room that that is not true. Medicare is an earned benefit. We earn it by paying into the program our entire lives and benefit from it when we retire. Now, unfortunately, we can't just earn it by paying into it anymore. We have to earn it by working to keep it, because Medicare and Medicaid are increasingly under attack by those who want to take it away in favor of tax breaks for the wealthiest 2%. Now, we're here today to keep earning our Medicare and Medicaid by making sure that Congressman King and Congressman Latham know that we want them to reject the Romney-Ryan budget that will gut Medicare and Medicaid. Now, to speak about that a little bit more, it's my pleasure to introduce Ro Foege, a longtime legislator and former director of the Iowa State Department on Aging.
Thank you, Matt.
Thanks, Ro.
Thank you, and good morning on this nice, warm summer morning. Thanks for joining us today to celebrate the 47th anniversary of Medicare and Medicaid. I'm Ro Foege. I live in Mount Vernon. I served in the Iowa House of Representatives for 12 years, including 2 years as chair of the Health and Human Service Budget Subcommittee. In 2007 and 2008, I co-chaired the Legislative Commission on Affordable Health Care Plans, and then in 2010 and 2011, I was director of the Iowa Department of Aging. Some think I can't hold a job. I have to keep changing. And as you can see by my gray hair, I am one of those older Iowans, and I am one of those older Iowans who I'm very pleased to be able to take full benefit from Medicare. And I want to thank Progress Iowa, the Iowa Alliance for Retired Americans, Protect Your Care, and AFSCME for putting this event together today. For 47 years, Medicare has permitted seniors to live dignified and fulfilling lives. 47 years ago, 25% of older Americans, only 25% of older Americans had any kind of health care coverage. Today, because of Medicare, virtually every American older citizen has the ability to access medical care. Today, over 500,000, 508,000 older Iowans and Iowans with disabilities rely on Medicare. Medicare is popular for one simple reason: it works. And Medicaid also plays an important role in providing health care for many Iowa seniors for people with disabilities and for working families in Iowa. These programs reflect American and Iowa values. When you work hard and play by the rules, by paying into Medicare, you will be treated with dignity in retirement. Americans and Iowans respect our parents and our grandparents, and we don't believe they should be left to fend for themselves. Now, after 47 years, Medicare and Medicaid are under attack. Congressmen Tom Latham and Steve King twice voted for the Ryan budget, a budget that guts and ends Medicare as we know it. At the same time, the Latham-King-Ryan plan gives even more tax breaks to the top 2%. Congressmen King and Latham want to break our country's promises to millions of Americans and Iowans who have paid into Medicare for decades so that Congress can give tax cuts to those who don't need them. Tom Latham and Steve King need to stand up for Iowans and say no to the ending of Medicare, no to more tax cuts for those top 2%, and yes to ending the Bush tax cuts for the wealthiest. We can make Medicare much, much more secure if the wealthiest 2%, who have done very well while the rest of America has struggled, if they pay their fair share. Latham and King want to repeal the Affordable Care Act, which helps seniors pay their drug costs by closing the donut hole. Because of the Affordable Care Act, also known as Obamacare, 9,300 older Iowans in Steve King's 5th district, that's 9,300 people in Steve King's district, have saved $5.7 million on prescription drugs. Some of those who saved on their prescription drugs are my relatives who live in northwest Iowa, in Sioux and Lyon County, in Pocahontas County. Those are places I was born and where I was raised, so I know that part of the flatlands of Iowa. Because of the Affordable Care Act, 8,800 seniors in Tom Latham's 4th district have saved $5.5 million on prescription drugs. That's $5.5 million that can go to other kinds of services and needs and wants that seniors in those communities have, and that keeps communities alive. In both the 4th and the 5th House District, 165,000 older Iowans have received free preventive care with no co-pays, no deductibles, or co-insurance due to Obamacare. Preventative care keeps older Iowans healthier, and it keeps them out of expensive hospital beds and out of nursing homes. And it keeps them in their own home and in their own communities. If we end Medicare as we know it, which is what King and Latham would like to do, Iowa seniors will struggle and lessen their quality of life. Iowans and Americans have liked, trusted, and depended on Medicare for decades, yet Representatives King and Latham ignored that when they voted for the Ryan budget. If Latham and King get their way and gut Medicare and Medicaid, what will Iowa seniors do? What will they do without? Will they have to skip doctor's visits? Will they have to cut pills and take partial doses? Will they have to take pill boxes like this one and not take medications on Mondays and Fridays? Will they skip meals? So today, I call on Congressman Tom Latham and Congressman Steve King and the rest of Congress to act now to protect Medicare and Medicaid. Let the tax cuts for the top 2% expire and stop supporting the Ryan budget. It's time to stand up for older Iowans. Thank you very much for being here today.